A very good afternoon to everyone. Welcome to today's session on social egg freezing by Apollo Fertility. To speak on the topic, we would like to welcome Dr. Shweta Gupta, our in house consultant, fertility. She has done her MBBS, MD, obstetrics and gynecology, MRCOG from London, DFSRH from the UK, FRCOG from the UK, and her MSc in reproduction and development. We welcome you, Doctor. You can now take over the session.
Thank you, Chatura. So, I'm going to speak today on a very interesting topic, which is social egg freezing. So, what is social egg freezing? It is the freezing of eggs, a plant freezing of eggs, and using it later on in life when the lady feels that it is the right time for her. And why do we need it? We need it because the eggs in a lady is not not it doesn't form all over your life. It is what you are born with, so the whole egg reserve is available only at the time of birth, and gradually it starts decreasing. The reduction in the egg number and egg quality is usually happens about the age of 35, and about after 40 it drastically falls down. So the fertility is very limited. It is, nowadays with the advances in medical science, the life expectancy has gone up to 75 and 80, but unfortunately the fertility life is still very much restricted, especially for a woman, and which is about 40 years. And that to the best time of fertility is from mid 20s to mid 30s or early 30s. So in this time you get the best quality of eggs and best number of eggs. But because of the social, structural social changes, a lot of women, they are giving more importance, or they are busy in their jobs or in their education, or they may just decide to marry late, or may decide to have a pregnancy much later in life. But the biological clock is ticking. So if she has the best time is gone in the education or in the employment, then by the time she's 40 she realizes that her eggs are already gone. So in order to overcome that, now the ART, the medical science has as an option available that they can do the egg freezing, more so around 31, 32, and freeze it and use it later when she's ready, when she's got a right partner, when she's done with her education, or when she has already a little bit settled in her education, in her employment. So this is an option which was earlier experimental, but now it has become a standard procedure which is available in our IVF centers. And this has a relatively a very good success rate. So this is what is recommended, that you better plan, the especially for the women who are busy with other things, that you have an option where you can plan your you can freeze your fertility and use it later on in life, when the time is appropriate for you. So this is what is the thought behind the egg freezing. And if we come to the next, that how do we do that, or how do women what do they expect in this kind of treatment? So here we do a basic assessment, as we do for any lady. We do a fertility check, where we do an ultrasound. We check the whether the ovaries have eggs, or the egg count or the follicle count is appropriate, and where there's a hormone which is called anti-Mullerian hormone, which is a fertility marker, is good or within a normal range. And after doing all the fertility checkup, if everything is okay, then we counsel the patient about this option of fertility egg freezing. Here we give follicle stimulating hormone. That is what we give for the IVF cases also, where we stimulate the follicles or the eggs. Follicles has egg in it, and we stimulate the follicles to make egg mature. it takes about 10 to 12 days. And with the egg maturation, which, when they are ready or when they are mature, then it is taken out with a very simple procedure, which is done under anesthesia, under ultrasound guided, with the help of needle. There is an aspiration of the fluid, or the follicular fluid is done from the follicles, which is a very simple procedure. It takes about 15-20 minutes, and it is painless because you are put under sleep. So and then that eggs are given to the embryology, and they actually see, and they under the microscope, and they freeze it in the freezing tanks. So the initial checkup for anyone who decides to go for the egg freezing, initial checkup by a fertility consultant, and then there is about 10 to 12 days of injections, and these injections are actually very easy to use, and it's licked with a pen, very thin needle, and the patient can use it themselves. And then after that, there is a small procedure, small daycare, small, just 2 or 3 hours one has to stay in the hospital, and the egg is retrieved, and then it is frozen in the lab. So it is something which a lady can decide at the right time, and I think that has given a lot of control in her life, because the she can actually freeze the eggs at that particular age. So the success of these eggs giving is dependent upon the age at which she freezes. So it should be the right age when you can freeze the eggs, and with a good number of eggs, there is a relatively a very good percentage of 60 to 70% success rate. So if you do it on the right age, the success is higher. If you do it later, then of course it reduces the success rate. So this is something which is now available, and a lot of big companies, especially abroad, they are actually giving this as they're funding this as one of the perks. Now the question arises, is that it very expensive? No, it is like what usual IVF costing is. It is almost similar, because in IVF also we do the egg stimulation and mature. Well, once the eggs are mature, then we take it out with this egg collection procedure, and we not just freeze it, we actually mix it with the sperm, the partner's or the husband's sperm, and we make embryos. So in egg freezing, because we are freezing egg, then the eggs are not mixed with the sperm, they're just frozen in that very state. And later on in life, whenever she gets whenever she wants to go for a pregnancy, then the sperm is taken from a partner or husband, and then they're mixed, and the embryo is formed, and then it is transferred into the lady's womb. So the steps which are left are the work in the lab, that's the ICSI or IVF, which is done at the time of her planning for pregnancy, and thereafter embryo transfer, which is very easy technique which can be done under ultrasound guided. As far as cost is concerned, it's almost similar to what normal IVF has, and along with this IVF, the cost of egg freezing, there is annual cost of freezing charges. But this is all very well counseled by the IVF units, that this is what is going to cost for the IVF stimulation, and this is what is the what she will expect for every year freezing maintenance charges, and when she decides to go ahead with the transfer, what will be the cost for the embryo transfer procedure. Now, sometimes we may find that the lady has come very late when the egg is already low, and still she wants to go ahead, and she can go ahead with that also. But in those cases, we have to sometimes do 2 or 3 cycles of stimulation and do a egg pooling, so that we have a reasonable good chance of success. Each egg may give about 5 to 10% of success rate. So we normally expect 8 to 10 eggs, good eggs, but in some cases, whatever we have to manage with that, or maybe do another 1 or 2 stimulation, so a package can be formed, so that we have good number of eggs which can give a realistic good chance, and then egg pooling can be done. And a lot of patients ask that, is it free painful? No, it's not painful. It's a very if a lady is working, she doesn't need to take any off time, only on the day of egg collection, because it is done under it is done under anesthesia. That is only one day she needs to take. Rest of the time she can go to her work. She can even take their injections herself, or with the help of somebody. They're very fine needles, and they're actually in a form of pen, which can be used. They can use it. So only one day off from the work. And It's something which is very doable. It has, a lot of the studies have seen that this is something which actually has empowered women in modern era, where at least even if they are busy with other things, they have one option is available of this fertility preservation. They may need it, they may not use it, but it gives them, I think, a lot of control on their life, that yes, they have undergone this, rather than getting worried about fertility decline, and taking up a decision of getting married with the person whom they may not find it appropriate, or under the pressure because the fertility is going down, or taking up lose, or not going through their educational, or taking a very demanding job which they actually want to do. So that has given them a lot of uh, empowered them, that they can take a decision and delay the planning of pregnancy later on. And also there are advantages, because if you freeze the egg early, the not only the success rate is good for the pregnancy, but also there is a less chance of any chromosomal abnormality. So the risk of Down syndrome or other abnormalities are much higher if you plan a pregnancy much later in life. So if you are doing a pregnancy, around 30 or 25 years old, the risk of Down syndrome is say 1 in 1500. But when you go down to the 40 years of age, the risk of Down syndrome increases to 1 in 100. So the chances of abnormal child, or the chances of the miscarriages are much higher if you do the if you plan pregnancy later. But if you freeze your eggs early in the life, that's going to reduce your chances of miscarriages, Down syndrome, and you can have your own genetic baby whenever you are ready, you feel ready for it. There is a question that, do I need to remove my IUD in order to freeze eggs? No, not really. You need to have, of course, a basic assessment by a doctor, where she's going to do an ultrasound and see whether your ovaries are okay, and they can be, stimulated. Your preconception, your other basic checks have been done. But Of course, it's doable whenever and it involves only 2 weeks of sort of involvement with the fertility center. Lot of centers are nowadays have this kind of option, and especially the good ones. So you can go and visit the center and ask that whether how good is their fertility, egg freezing, or the survival rate, and ask them very clearly what are the charges of the egg stimulation or the freezing, and what will be the annual charges for the for the freezing charges, maintenance charges, and what will be the charge of in case if they decide to go for the embryo transfer. There are a lot of questions that there are any side effects. Not really. These follicle stimulating hormone which we inject for maturation of eggs is quite safe, and this is what we use it in routine IVF. The IVF has been now there for more than 40 years, and moreover, there is a very close monitoring. The monitoring of the stimulation or these injections, when we are using hormone injections, is done by two ways. One is by an ultrasound, where we get to see the follicles. We can actually measure what is happening in the size of the follicles in the ovary. And also the other test is a hormone test, E2, which is estradiol, which is also released by these. So we can have a close monitoring with an hormonal and an ultrasound. These are the two independent ways of checking it, and then we can adjust the dose accordingly, whether we need to increase the, if the response is poor, then we increase the dose, or we reduce the dose. So it's a relatively safe. Of course, there is a small risk of, like any surgery, there is a small risk of infection, bleeding, or hyperstimulation, but they're very minimal, and in good centers there are good systems, or the quality control systems are in place, so that they're very well monitored. And these hormones, they usually subside by the next cycle, and they're not, they don't have very much long lasting effects. So there is another question: when will the period comes? Once you have the frozen the eggs, after a week or two, you will get your periods. It can become a little bit irregular because of the hormones you have used, but it may take a month or two, just for your ovaries to come back to the normal size, and I think you just have to give some time. But other than that, there is no serious long term effects. Egg freezing is now a standard is standard procedure. It was earlier experimental, but now we have got a very good good freezing technique, and it's called vitrification or fast freezing. And this has got a very good when you thaw it, when you take out the eggs, it has a relatively good success rate. It is not 100% guaranteed, so I won't say that everyone should do it. Shouldn't it is an option which is available for women who have no near future plan of pregnancy. But of course, having said all that, the best is to conceive naturally. But in cases where the circumstances are not permitting, this is an option which is nowadays available. um, And now there's another question: how is embryo freezing different from egg freezing? Egg freezing means only you are taking out the lady's egg and freezing it. Now, if she has a partner or husband, then she can mix it with then it is mixed with the sperm, either with a simple IVF technique, or with the NICSI, where with the help of the microscope, each sperm is taken and injected into the egg. So, and then embryo is formed. So embryo is a combination of both egg and sperm, or a small, tiny baby. So embryo freezing has been there in ART medicine, in sciences for many years. Egg freezing is a relatively new technique, but having said that, it's been there for about, I think, 8-9 years, and a center like us, we have been doing it for many years, and we have already got successful babies. So embryo is complete, egg and sperm. So if you have a partner, you can even go for embryo development and embryo freezing. But if you don't have a partner, then you can just do the egg freezing. Now the question is, at what age should I consider freezing my eggs? So as I have said, that the best fertility is from, I would say, from late. You should start thinking from late 20s to early 30s. But the best time is, the earlier it is, the better it is. Once you are after 35, you can you may expect some kind of reduction in the quality and quantity, and especially all the more so in Indian setup, there is an earlier decline in fertility as compared to the Western books. So I think in around 31, 32, if you think that you are not going to get married immediately, then you can go to a fertility specialist, get yourself checked. She will look into your egg assessment, and then accordingly she will advise that if this is the right way, and then you can plan. So I think that is all, but if you have any more questions, you can always message us. And I think with this we will end the session. Okay, thank you.